Welcome, Dr. Bhagyashree. How are you?
Thank you, sir. I'm fine, sir.
Please tell me about your qualifications.
Sir, I have completed my MBBS from Vasantrao Pawar Medical College, Nasik in the year 2017 with first division. Then, sir, I have completed my MD Anesthesia from Government Medical College, Latur in the year 2023 with first division, sir. Currently, I'm working as the...
What is your experience?
Sir, I have done I have joined as a medical officer for 6 months after my MBBS. Currently, I am working as a bonded senior resident in Yashwantrao Chavan Memorial Hospital, Pune, sir.
Okay. Tell me about types of anesthesia.
So there is general anesthesia, then regional anesthesia, then sedation and local anesthesia, sir.
Okay. And tell me the stages of anesthesia.
So there are 4 stages of anesthesia. So first is analgesia, then delirium, then surgical anesthesia, and the 4th one is respiratory arrest, sir. In stage 3 also there are 4 phases of anesthesia. In that the phase 3, that is phase 3 and stage 3 is considered as surgical anesthesia.
Okay, why you opted to be an anesthesiologist?
From the beginning, I have interest in medicine, sir. But when I had given options in that, sir, in anesthesia there is medicine part also, as well as practical skills and practical part also is there, sir, in anesthesia, that we apply medicinal knowledge in a practical basis, sir. That's why I like anesthesia.
What type of emergency cases you have handled?
I have I have managed obstruction cases, perforation cases in surgery patients, then trauma patients, road traffic accidents with upper limb, lower limb fractures. In our day-to-day basis, I am managing this type of cases, sir. Also, ruptured ectopic pregnancy patients, sometimes sir, eclamptic patients also. Eclampsia, preeclampsia, then sir, abruption. Yes, sir.
What motivates you to join army as a doctor?
Sir, I want discipline, punctuality in my profession, sir. And the army, this is an estimate organization, sir. It will be pride for me to work in such an esteemed organization. And also, sir, my father-in-law, he worked in army. He was in AMC for 17 years. He served our country for 17 years. And whenever he shares his experience, I got motivated. I got inspired by it. That's why I want to join our medical corps, sir.
See, army life is not a bed of roses. So what are your views? As you are married also?
Yes, sir.
So how will you manage your family? And this is a very tough job. Don't you think so?
Yes, sir. But sir, I will manage, sir, because my family
how will you
also,
manage?
Sir, my family also motivated me and supported me for this decision to go ahead with this profession, sir.
Okay.
Yes, sir. And I will try to balance my professional as well as my personal life, sir. And my husband is very supportive in this decision, sir.
Your work is on the priority. Like anything happens, and anesthesia is the first choice we have to make. So we don't have any option. When any severity, you are being required. So what type of work you want over there? Like you want to work as an anesthesiologist, or you are ready to go for all MO works?
Sir, I'm ready to do all type of work.
Then tell me the complete role of MO. What do you know about the work of MO?
Sir, medical officer, he attends outpatient as well as inpatient services. Then he supervises PSC staff to to handle minor ailments in a PSC place. Then also, sir, medical officer, he organizes various camps, various health programs, family planning programs. Then he supervised vaccination programs also, sir. Then he managed to supervise the cold chain maintenance, then vaccines, then drug management also, sir. Then referral services, he also supervised the referral services. Then lab services. Yes, sir. And he coordinates. He coordinates with the referral service so that there is a smooth and proper shifting of the patient across the hospital. And he also encourages and motivates the people to take the advantages of various campaigns also. So overall awareness, he manages to do that.
Okay. One personal question. How are you feeling with PD classes? How you felt about the course and 7 days and 1-to-1 session and all this?
Sir, first of all, I was not aware of this Army Medical Corps, sir. But sir, when I got to know about the PD classes and with the help of sir, I got to know many things which is very necessary for this interview, sir. I got to know about the body language, then medical aspects and other important aspects which is very required. And so this class is very helpful for me. I'm very happy with this class, sir.
Thank you. Okay, tell me neuromuscular blocking drugs.
So there are short-acting drug and long-acting drug. In it, there is also the competitive class, sir, and non-competitive one. In competitive, sir, there is succinylcholine. It is short-acting competitive drug, sir. So we give succinylcholine at the time of induction. And then there are long-acting drugs such as atracurium, vecuronium, rocuronium, and pancuronium, sir. From this, in our institute, we use atracurium and vecuronium, sir. It is a non-competitive one, neuromuscular blocking drug, sir. We use atracurium or vecuronium for the maintenance of general anesthesia, sir.
Okay, doctor, my next question. Intravenous anesthetic drugs. Tell me.
Sir, there is propofol, then thiopentone, ketamine, sir. And midazolam, we use midazolam, we can use midazolam as an IV anesthetic drug, sir. So we give IV anesthetic drugs during the induction of the patient of general anesthesia, sir. Yes.
Okay, doctor. Now my question to you is, like, see, you may have to work for some general medicines, community, and all these also. So, would you be able to handle such patients also? Like if you get patients of malaria and all this.
Yes, sir. Yes.
Can you tell me the doses of chloroquine?
So chloroquine we give in adults, we give 1 gram per day for first day. And then, sir, we give 500 mg after 6 hours and then 24 and 36 hours. So in children, we give 10 milligram per day on first day. And then, sir, after 6 hours, we give 5 milligram per day. And then after 24 and 36 hours, sir.
Is the standard dose 300 mg or 500 mg?
Sir, 500 mg, sir.
Sure.
Yes, sir.
Okay, doctor. What are your strong points, strengths?
Sir, I'm self-confident. So I can work under any type of pressure. I can manage any type of emergencies, sir, from my experience. And yes, sir.
Tell me about your family.
So my husband works in an IT company. My father-in-law is a retired army person. He served our country for 17 years. Now he is working as a cashier, head cashier in Bank of Maharashtra, sir. My mother-in-law is a housewife.
Okay, doctor. Okay, give me your complete introduction.
Yes, sir. Okay, sir. Good morning, sir. I'm Dr. Bhagyashree. I belong from Pune, which is also known as the Oxford of the East because of various educational opportunities available in Pune. So I have completed my MBBS from Vasantrao Pawar Medical College, Nasik in the year 2017 with first division. Then I worked as a medical officer for 6 months. I have completed my MD Anesthesia from Government Medical College, Latur in the year 2023 with first division. I have attended, then currently I am working as a bonded senior resident in Yashwantrao Chavan Medical Hospital, Pune. I have attended several seminars and state level CME in Pune and Samajinagar. As far as my strengths are concerned, sir, I am self-confident. I can work under any type of pressure. I can manage any type of emergencies, sir. Thank you, sir.
Tell me about your college life.
Sir, I did my education till 12th standard in my hometown. Then I prepared for MBB, PG, NEET UG, and I have completed my MBBS. I was in Nasik, sir, for almost 5.5 years. In those days, I have learned so many practical skills along with the theoretical knowledge from my seniors, from my teachers, and from my colleagues as well. I learned how to speak or how to counsel the outpatients in outpatients facility. Then I learned how to manage casualties also. So whenever we friends hang out together, we used to discuss so many topics. And what we learn and what and the mistakes we did in those days. So we used to discuss that, and we used to learn things, sir, from our mistakes also. And yes, sir.
Okay. Any complicated case you handled where you felt, yes, I have shown my strengths, or I'm very competent, sir, I've handled this case, trauma or any case where comes in front of you?
So once one patient with blunt trauma over abdomen and chest, he came to casualty with unconscious level. Then the patient was shifted to recovery room in the recovery room. So at that time, first of all, we secured the airway, sir, of that patient because he was unconscious. He was not able to take breaths. So first of all, we secured the airway. We intubate the patient. We secured two IV intravenous lines, sir, because the patient was hypotensive. He was in shock. Okay. So we secured IV lines, and immediately I gave ample amount of IV fluids to restore the blood volume. Then we managed to arrange blood and blood products. Till the time we give inotropic drugs, inotropic support. I give noradrenaline. Then after securing airway and then vitals, we immediately shifted during this. We immediately shifted patient to operation theater. In operation theater also, we give necessary drugs. I give necessary drugs to the patient, and then there's a procedure started. And intraoperatively also, sir, I try to stabilize the patient's vitals, that is the blood pressure, pulse rate, etc. Sir. And post-operatively also, so the patient was the vitals was stable. We shifted that patient to the intensive care unit, and we monitored that patient for almost 5 days, 4 or 5 days. And in the last, the patient was extubated, and he was conscious enough to speak, and the patient was stable, sir.
Oh, wonderful. Doctor, you have given a very good interview. Okay, keep it up.
Thank
Some
you.
loopholes, let us talk. And some topics like OPC poisoning have been given a lot many times. Live vaccines, they are giving topics. Abdominal pain is very important, right? Okay.
Okay, sir.
And some
Okay, sir.
loopholes we'll talk right now. Okay. I'll tell you some loopholes,
Okay, sir.
what I found.